When it comes to welcoming a new baby, having the right care and support from those first moments in labor through recovery can make all the difference for moms and families.
Welcome to What Brings You In Today, a podcast from SGMC Health.
I'm Kara Hope Rockwell.
And I'm Erica Bennett, and today we are here with Joley Sumner and Carly Cooper, who are registered nurses within our Women's and Children's Department here at SGMC Health. And so really they're going to talk about all the fun things that happen, the best moments that happen at SGMC Health, which is delivering babies. So Carly and Joley, what brings you in today?
We're here to talk about delivering babies at SGMC Health.
All right. Well, let's start by just introducing you to our listening audience. So if you can tell us a little bit about your background, how you got here.
Okay. I'm Carly Cooper. Like Erica said, I am a labor and delivery nurse. I started out in postpartum. I worked 1.5 years in postpartum first, and then I decided I was ready to spread my wings a little bit. So then I moved to labor and delivery, and I have been there for 4.5 years. So I have a total of 6 years with SGMC Health.
Awesome.
I'm Joley Sumner. I started in labor and delivery.
Okay.
And did a little stint over there. It wasn't very long, but then I moved to postpartum, and then recently moved to the nursery, and then back to postpartum for this mother-baby transition. Yeah. And I've been here since 2018, so this is the only hospital I've ever worked at. It's home. Okay. I really enjoy it.
I love that. So what led you both into nursing, and why did you choose women and children?
So nursing, I just fell in love with helping people. Just growing up, I always wanted to help somebody any way I could. And through my grandfather's health journey with cancer and everything like that, I knew that I wanted to become a nurse because I felt like they just made a big impact on just a community, the patient, and everyone involved. And then when I went to nursing school, I really didn't know what I wanted to do. I thought I wanted to do pediatrics, and then I decided, maybe not pediatrics. So then I just decided to stick my foot in women and children, and I fell in love and haven't moved since. So...
I dropped out of business management because I was like, no,
not for me.
And somewhere along the way, I was like, it sounds fun. Let's go be a nurse. My stepmom's a nurse. So I've always enjoyed just any conversations you would have about that. And in clinical, my first day in labor and delivery, I got to hold a leg and we were delivering a baby, and I was like, oh, this is it. I'm hooked.
Yeah.
And then it just kind of took off from there. I knew exactly where I wanted to be.
It's not something that most people get to see, right? And y'all get to see it multiple times a day. How does that feel? What does that feel like to you, seeing that so consistently?
It's just so, it's just a blessing, honestly, to be able to walk with a mom and the rest of the family. You really, after the delivery, you feel like you've all become a family. You've all intertwined with each other. You've all gotten close. And it's really a blessing to, be able to see these babies enter the world every day. Some days are harder than others, but most of the time we have a joyful, exciting time. Stay very busy, but it is truly, truly exciting.
Yeah,
it's just a special time. Thinking about that made me think about when I delivered, and I had 2 babies here at SGMC, and there's really no way you can describe it until you're there and you have done it. But such a
some
life-changing event.
Yeah.
There's a moment.
These patients have waited 10 months.
As soon as that baby's born, everybody is quiet. And it's just a really
a peace.
And it's so split second. And then all of a sudden there's mom's crying, baby's crying, dad's crying.
Everyone's all crying.
So, it's just...
all the emotions.
Yes, it's kind of magical. It's cool.
Yeah, it's so much fun.
Well, let's kind of talk about, the journey of having your baby here. And it does start before you get here for labor and delivery. When in your pregnancy, we offer some parenting classes. So can you talk a little bit about that and what that offers for patients?
Caitlin, our lactation consultant, does classes twice a month. It's 2 separate classes that talks about epidurals, birthing, kind of how we do things here, and breastfeeding. And that's a really solid start for a lot of our families because most people don't know what to expect coming into this. Even if you've had, I've got 4 brothers and sisters. I had no idea what I was going into when I was delivering my own baby, and I worked here. Right. So, you kind of I don't know,
kind of gives them the stepping
Yeah,
stones
like it's
to
kind of like a good foundation to kind of jump off
yeah.
on. And
Yeah, and through Caitlin's classes, she also does a tour with the parents. So they get to come up and tour labor and delivery. She kind of points out, these are our labor rooms. And then if you are a scheduled C-section or something like that, we have the ORs back here. We have 2 ORs. And then she kind of shows the antepartum OBED unit. So if mom has any obstetrical problems during the pregnancy, she'll come to OBED and get triaged. And then as well as if the doctor sends them from the office, they go to antepartum. And then she takes them to postpartum and shows them postpartum over there and in the rooms and things like that. So they kind of have an idea of where everything is, even though it can be kind of intimidating when you come to the hospital and it kind of like, whoa.
very much so.
It all runs together. But yeah, so she does that as well.
Yeah. It's interesting when you're talking about the education classes and like not remembering things, even from child to child. You can forget what it's weird how your body like forgets. I think it does it on purpose. It's like, I'm going to make you forget what this was like.
Amnesia.
So you'll have another baby.
That's right.
Otherwise, you might be like, no, I'm good. But like, I remember I couldn't remember if you were supposed to burp the baby after you breastfed.
Right.
Like, I know you do after bottle fed, but I was like, do they get air? How does that work? And so, but just the nursing staff, the lactation consultant that's there is obviously there to help you with any of these questions, so that's so beneficial.
Yes, and Caitlin is our lactation consultant, and she's typically here Monday through Friday. She like 7 to 3, something like that.
Yeah.
Something like that. But even if she's not here or, she's off or it's the weekend, everybody here is trained in breastfeeding. So we are all able, anybody in pink should be able to help the moms so they don't feel like, they're doing this on their own and they feel lost. We're all here to help. So
everybody gets a basic kind of tour.
And that is a thing to note that all of our women and children staff wear pink, so that is why they're in pink scrubs, so you can always recognize them when they're out and about.
Yeah. So you both support different stages. Carly, you work in labor and delivery, and Joley in postpartum. How do y'all work together on the unit?
So, I mean, it's just a mix of things. We might be postpartum a lot of times get some of our C-sections ready. So we're going to pick up the patient from them. They're giving us the story. They've already prepped them, things like that. So we are intertwined in that way. We get the C-section, we do the C-section, we recover the patient, and then we take them back to them. As well as with vaginal deliveries, we've been, we're getting ready for mother baby, so we're excited about that. And so we're doing handoff on both mom and baby. And so we're helping over in labor and delivery, get the baby situated, get settled. We do have an admission nurse that is typically doing medications for us. If possible, a lot of times the babies decide to all come at the same time. So, then it's all hands on deck. And then we hand off, when we come and take mom and baby over, we hand off to our postpartum nurses who are now getting ready to do mother baby. A lot of us, we're doing a lot of cross training right now to get everybody ready. Several of them have trained to nursery, several of labor and delivery have trained to nursery, and so we're kind of doing phases of getting that training in, so we're all cross training.
So when you mention mother baby, because most people probably don't understand what that means. So what does that mean? That means that
and I think it's September 1st, we kind of do a soft launch for this for us. Mom and baby will be cared for by the same nurses, and which I don't know if it'll still be called postpartum or not.
Right.
But it'll be like the postpartum unit will be a mother-baby unit, and they'll have the same nurse. It's good continuity of care. They have one face to keep up with versus 2 different people that you don't really know who to ask what, which can be confusing. I mean, even when I worked here, like I would... You're in that postpartum haze. You're not really remembering who's coming in and out of the room, and everybody wears pink, and you're like, you all look like Pepto-Bismol bottles. Like I don't know who I need to ask questions to. So having the one face for both of you will be, a lot of our moms are already raving about it. They're like, I like just being able to ask a question and you having the answer. So I feel like when the new building is finally complete and we're moving in there, like we'll be rocking and rolling.
Yeah.
I mean,
and just also for clarification for the listening audience, if you have not been pregnant or maybe you've never been to a delivery unit, tell us what the difference is between antepartum, labor and delivery, postpartum, and nursery. Because we mentioned those a lot, but they're like, what does that mean? Especially the antepartum and postpartum, because those are not like terms that people.
So it is definitely confusing, especially if you don't work in healthcare or you haven't been to the hospital. It is very confusing. Antepartum is so before we have the baby, which also sometimes if a patient goes into the hospital not the hospital, if they go into the doctor's office and after having the baby and they're having maybe blood pressure problems or things like that, they may send them to the antepartum unit to get some workup done, triage and everything like that. But antepartum is typically prior to having the baby. And then OBED, kind of the difference between the two is antepartum is if the patient's been in the office and they've seen the doctor and the doctor's called over orders, things like that. OBED is they may have called the office but might not have been seen today, and they just need to be triaged and kind of worked up. We do have our 24-hour OB hospitalist program, which is phenomenal. So what that is we have a hospitalist that is on for that 24-hour shift. They come in, they triage the patient, then kind of do a workup on them, kind of like if you're in the ER. And then if needed, if they need to be admitted or anything like that, they will hand over to the patient's primary OB, and they take over from there. If the patient's getting admitted from labor, they're calling them saying, hey, I got your patient. She's like 3 to 4 centimeters, let's see what you want to do. Admit them. That doctor takes over. And then labor and delivery is where we are going to have the baby. And then, or if we're having, to stabilize patients that might be trying to have a baby too soon, we might be doing that's going to be there. And then postpartum is where we hand off to Joley.
You have your baby, or if you're being admitted for an antepartum problem, like you may end up on postpartum for a little bit, just hanging out with us because our rooms tend to be a little bit more comfortable. And we give you that fetal monitoring and everything you need there. But then after delivery, when you come over to us, we're taking care of you and baby now. Our nursery and our NICU are going to be a little bit more separate. We're going to have just a NICU, and then postpartum will be the mother-baby unit where we're taking care of you and baby. So that way, our nursery staff, they're being trained. I think they're going to be trained for level 3 here pretty soon. So we can take in a larger variety of patients. So that way we're not having to send not everyone, but
are really early.
Really early off. You can kind of keep everyone closer together and really take care of the family as a unit versus having baby in one hospital and mom in the other.
So currently we're a level 2B neonatal intensive care unit, and we did get approval from the state to take that up to a level 3 NICU. And I know that y'all seem to already working on that. We don't know exactly what the timeline looks, but sometime shortly after we open up the new tower, the new Women's and Infant Center, the community can expect that to come in the near future. And that is so important for those families because
we're very excited about it. In the fact that if we have a mom that's just right at that mark of, hey, we can take the baby, 30, I think it's 32 weeks usually around there. We can typically, if it's above that, we can keep them here. But if it's below that, we need to send them somewhere, and it's terrible having to send a baby and a mom separately. It really is heartbreaking because, you want to be with your baby. You've carried this baby for, at that point, however many months pregnant you are, but you want to be with your baby. And so we have had to transfer several patients over there to typically Phoebe is where we send to, so that they can be together and be at that higher level NICU. So we're excited to have a higher level NICU here to where in the future where we can keep those moms and babies together.
Yeah, that's important.
Oh, that is so exciting.
Yes.
It's going to be great for our patients.
Yes.
For first-time parents who might be nervous coming in, how do you make them feel comfortable?
I mean, it's nerve-wracking.
Yeah.
I mean, you're like, me, myself, on discharge day, I remember sitting there staring at my daughter thinking, they're going to let me take her home.
Is this
I'm not
legal?
qualified.
So, there's, honestly, I think we try and be like a big family.
Yeah,
like
we do.
we're your cousins, your aunts, your
Yeah.
uncles. Like ask us any questions you have because there's nothing that we haven't been through at this point.
Yeah.
I'm sure
And
I've
we're
seen
just
it all.
like
And the patients
it
often
all.
are like, this might be a crazy question or this might be a dumb question. It's not.
It's not.
It's not.
It's
we would
not.
rather you ask.
Yeah.
And I mean, sometimes we're like, I'm not
Yeah.
sure on that, but let
Yeah.
me
You
find
know,
out the answer for
let
you.
me let me consult some friends, and then you got to the desk and you're like, okay, gather around. Like,
Yeah, let's all come together here.
we gotta have a little Einstein chat. Come here.
Yeah. And like in labor and delivery, I just go in and I just welcome the patient and I just want them to feel comfortable. I don't want them to feel intimidated because a hospital can be intimidating, it can
Absolutely.
be scary,
Yeah.
especially if you've never been in it before, it can be scary and they don't know all the, this is new to them. So I just try to go in and welcome them. And I like to know, what their plan is. Some people have birth plans. Some people, they don't. It just depends. And I just really want to try to make their plan and how they want their birth of their baby to go. I try to make it as close to what they want as possible. So I like to go in and be like, okay, what's our plan? Are we getting an epidural? Would you rather not? I'm open to anything you want to do. Let's do it, as long as it's safe for you and the baby, absolutely. So
Yeah,
I
it's
just,
very important to let us in on your plan because
Yeah.
we want to make sure that we can get as close to your plan as possible. But
Right.
with the rise in like certain forms of social media, there's a lot of
Yeah.
unsafe plans
Yes,
Yeah.
there
that
Yeah.
are being
I
brought
could
to us,
definitely
and
see
it's
that.
so we,
Everybody's an expert
Yeah.
right.
on social media
Yeah.
on what you should do.
Right. So we definitely try to, welcome them in and figure out, what are their preferences, what they like, and let's figure out how we can try to meet that as well as possible.
Advanced tools and technology. I know we've added some tools to our tool belt in regards to care for baby and mama. Can you tell us a little bit about those? I'm thinking like the wireless
Yes.
monitoring, the AngelEye, maybe,
Yes,
and
so
hit on some of those.
absolutely. So the wireless monitoring is actually one of my favorites. It just because it kind of frees up the mom a little bit. Sometimes I'll be honest, it works. It's technology. You know how that goes. So sometimes it works, sometimes it doesn't. But I'm always willing to give it a shot. We do have to put the moms on like the regular monitor for at least probably 30 minutes or so to get a good fetal tracing, and then we can try the wireless as well. And a lot of times it works great. It gives mom a little more freedom to be up, go to the bathroom. Some moms like to get on a birthing ball, it helps them. I do tell my patients, like I told y'all, it's technology. Sometimes it works, sometimes it doesn't. But let's give it a shot, I do tell them that as the baby gets lower and we're getting closer to delivery, sometimes it can be a little bit difficult to trace, just because we're getting lower. But at that point, if we need to, we can go back to the other monitor, and usually at that point, we're getting close to being finished. And then our beds, our labor and delivery beds, we can put those in just about any different position you need them to be.
I looked at the guide on that when we first got those. I looked online and they had like this infographic with all the different positions that moms can get in on the bed. I was like, wow.
And it's pink.
Yes, and it's pink.
There we go.
Surprise.
And then AngelEye technology.
Yeah,
So
AngelEye
that's
is great. We use it with our NICU patients, or if we have a mom on MAG and she can't necessarily have baby in there with her at any given point. It's cameras that we have set up with secure access. Mom can pull it up on her phone. She can give the link to whichever family members that she would like to have it, and you can just live stream your baby, and you can watch pretty much their whole little life while they're just in their little incubators nesting.
Yeah.
Well, they're not incubators, but that's what my patient earlier called them.
essentially. Little cocoons.
And so you can just, you can watch them, and most of the time they're just kind of laying there chilling with their pacifiers or sleeping. But, they don't do a whole lot.
Yeah.
But it's a reassuring thing.
Right, to be able to look at them.
Look at
You
them
can watch them
yeah.
and see and make sure, it's a secondary reinsurance for you that they're safe and being taken care of.
Absolutely.
And you could also share with grandparents
Yeah,
or family,
absolutely,
and
yes.
they can
Yes.
tune in too if they're not able to be here. So
Absolutely.
that's really
Absolutely. Yes.
nice. Yeah. After delivery, we kind of turn to like bonding. So what does that look like? What is your role in helping moms in that very first few hours.
Minimizing like any sort of like outside distraction, I think would be like probably the main goal for us on our unit. If you have 47 people in there with you right after, like they're playing hot potato with the baby. I mean, it's just, and it's kind of hard. And you can see these moms and they're just kind of like getting overwhelmed. And so sometimes it's like our responsibility to come in and be like, hey, visiting hours are like da-da-da-da. But it's being there and like kind of reading your patient and knowing like, okay, she needs help with this, or let's try and help her out with that. And not being afraid to just ask the hard question like, hey, like, do you need me to kick everybody out? Do you like what kind of like how do you need to bond? What do you need my help with? Because I mean, let's face it, it's a natural experience. Like you kind of as soon as you have your baby, you're like, okay, I want it. I want to keep it right here, like right here. And a lot of times you're kind of scared to ask for that. And so you feel safe to look at any of your nurses in pink and be like, I want my baby, bring it to me. Because I mean, we don't mind.
Because I always tell my patients, I was like, I will be the bad guy, and I will tell everybody we need some time, you know.
That's awesome.
And because I mean, we know that the families obviously are ready to love on this baby as well.
It's a huge support system, and like they're there for you.
But we want mom and dad to have their time too, you know? And so I definitely, if my mom wants to do skin to skin, as long as baby is looking good and we don't see any signs of needing, you know, some oxygen or things like that, I'm definitely like, hey, let's do some skin to skin. Like if they're wanting to breastfeed within the first hour, let's do it, you know? Those are two major things that I definitely try to do with my patients if they're wanting that. So.
I mean, it's really a transitional period. Like when you're on our unit, most of the time, you're not like sick. So it's more of like getting you used to what you need to do to take care of a baby. Like how you respond to things. Like if you've had a C-section, teaching you how to get up and manage manage your pain, get up, be able to take care of your
yourself.
Baby. Yeah, take care of yourself. Because we have you for such a short time. Like 48 hours is a good average, like that we have most of our patients. And if you think about it, that's a really, really like brief period to teach someone to take care of a new baby.
Absolutely.
Like it's
while you've got all your other stuff going on.
Yes, exactly.
Like, you're our first time moms, like a lot of them are so gung ho. They're like, yes, let's do it. Like, I'm ready to go home with my baby. And then I think like back to me and I'm like, I was not prepared for that.
You probably have some that are also like, no, I'm not. Can I say that?
I mean, we've had some moms that they're like, okay, are we sure? And I'm like, yeah, like I'm sure. Are you sure? Like, I mean, what kind of questions do you have? And then we've done the whole discharge process, and then the next thing I know, we're sitting on the bed for the next 30 minutes, just looking at one another talking. And I'm like, you've got this, you're fine. Like I promise you, like we are not going to send you home if we don't think you have it.
Right. And then we're always still a resource after they go home. Sure. So I mean, I always tell them like, just if you have any questions, just call us back. You know,
your discharge packet has every phone number for us, like for all the different units.
Absolutely.
If you call one and they can't help you, they'll transfer you to who can. I mean, Caitlin, our lactation consultant, does outpatient
consulting. She still does. She does that. So she is still a resource as well, and she's a great resource at that.
Yeah, I had to do that, and I was even working here, and I still think I didn't really understand that you could still have that conversation with my son after we had got home. Maybe it was like a day or two. He like coughed up or spit up like blood, and I was like, oh my God, like this is gonna be bad. And I called him. They're like, it's probably just some remaining like whatever fluids that he probably had, and he was completely fine, didn't have any issues. And so just having that sense of like, okay, we're good.
Having someone you can call as a lifeline, I mean, that's a huge plus for
trusted medical advice. You know, not going to Google in those cases.
Absolutely.
No TikTok this time.
That's right.
Just call us.
Like, ask the experts that do it all the time.
That's right.
Because if we don't know the question, we're gonna be like, okay, hold on for just a second,
and we will,
and then everybody converges on that question. So I mean, like we figure it out.
It matters for sure.
Something else we also want to touch on the Safe Sleep Initiative. So can you talk about that and how you educate families about safe sleep and why that's so important?
So we have posters in all of our postpartum rooms that have like the picture perfect safe sleep, which is a fitted sheet, flat in the crib, baby flat on their back, and just a onesie. That's perfect. No crib bumpers, as cute as they may be. They're a huge hazard. No stuffed animals, no blankies. We live in the South. Let's face it. They don't need all that right now.
Yeah.
Like, it's 100 degrees by 10 a.m. Like, we're good. And even when it's February, like, it's still, I mean, the majority of us in our area, our homes are not 20 degrees.
Right.
They don't need to be bundled up where they could possibly roll over and accidentally, be smothered or something like that. It's an initiative to help prevent SIDS. It's a huge learning curve because a lot of old school people, they have to be bundled up completely. You want to make sure that they're completely swaddled, and once a baby starts getting mobile and moving, you don't want to swaddle anymore, because if they can't pick themselves up, then it's a risk.
And even things that, like you said, it's a learning curve. Things have changed.
Yeah, they changed. Like
one of the new policy or studies or things is don't wear a hat if the parents are if the parents are asleep. Don't leave the hat on the baby. If the parents are overheating. You're right. So if the parents are awake, then you can obviously have the hat on the baby and watch baby from there. But I know through my nursery orientation, just crossing over here recently to prepare for Mother Baby, they were telling me about that. They're like, so we're telling parents now, based off of studies, that when mom and dad are asleep and baby's asleep, let's take the hat off and not have the hat. So
because they can't regulate their temperatures very well.
Yeah.
And when if they get cold, they tend to cry a whole lot more. It's kind of something we've noticed. But like if they start to get really warm, they don't really have like a trigger mechanism for that for you. You just all of a sudden they're just like baking themselves.
Yeah.
And when they're like
they're just sleeping
over swaddled and they have the hat.
Sure, yeah.
So if mom and dad or whoever happens to be the support at that point for baby, if you're alert, you're awake. I mean, baby's cool, like having the hat on and everything. But if you're gonna go to sleep, like you can take baby's hat off, put them in a onesie, nice flat sheet in the crib, no stuffed animals, no blankies. I mean, them and their pacifiers, pretty perfect.
Yeah.
And trying your best not to fall asleep while
Yes.
you're holding them.
yes, while you're holding them.
Yes.
Especially as a new mom.
As hard as it may be,
Yeah.
and as sweet it is to snuggle with them, definitely
Yes.
try not to fall asleep
Yes,
while you're
that's
holding
a
them
huge.
and snuggling with them.
Yeah.
So.
I mean, in my opinion, that almost feels like the biggest risk
Yeah,
of,
it is.
It
of
is.
injury for a
It
baby
is.
or whatever,
Yes.
what have you.
Yes.
Just because it's so tempting to
It is, especially when you're
Yeah,
exhausted.
everybody's tired. too.
Everybody's tired, so it's like, let's all snap together,
Yeah.
but let's not nap
Baby's
together.
crying, you're on the verge of crying, and every time you pick baby up and put them here, they stop, and it's just, you're like, okay, this is what we're gonna have to do. But I mean, the minute you start getting
Let's go
I
ahead.
think
and
it's
baby
important to
does
know that it does happen.
Oh,
like
yeah,
people
absolutely.
do.
It does.
Well, they fall asleep, but also like babies are dropped.
They
like
are.
they do
Yes.
fall. Parents
Babies
fall
are
asleep.
dropped,
They
they do
hit
fall.
like, and you always want to think, I don't hear that happening, so this isn't going to happen to me. So I have heard of stories of that
Yes.
since being a mom. I was like, oh my gosh, I wish I would have kind of knew. You know, 'cause
Right.
you're like, oh,
Yeah.
it's going to happen
Yeah.
to me.
It's not something you would want to talk about.
Right.
Of course.
Right.
Yes. Yeah. But I think just shedding light to
I
it
did it.
so that you. I know.
I mean, I
too.
was a
I did
I
too.
breastfed. I was at home by myself. I was rocking her, and I had her like this, and I felt myself kind of do this, and I was like, oh my god, I could have dropped her.
Yeah.
Like, so then I had a whole life meltdown. But I mean, it was instantly like I was
Yeah.
in her bed. She was fine, but then like I sat there and I was just like, oh my god, what if I dropped? Because you just like, and I'm like, I'm
We're all trying
trained.
our best.
I'm trained.
Trying our best. Yeah.
So
Well, we're getting close to the end of our time, but I wanted to ask y'all what you're looking forward to most about the new Women and Infants Tower.
Oh, I don't know. I'm
I'm
excited.
excited.
I joke about this all the time, but I'm really excited about bigger doorways for our beds.
Yes. Yes.
That might be one little
Yes.
small thing, but just being able to get in those rooms easier and not bumping
Bigger
sides.
doorways, bigger rooms.
Yeah,
Like,
bigger rooms. Just
More space.
Just
Yeah.
more space for.
Those are probably the
yeah.
two biggest things I'm excited
Yeah.
about.
million.
Like the whole new building is fantastic, but
Yeah.
I mean, if you've ever tried to get a bed into a postpartum room, home.
Yeah.
Especially with a C-section patient
Yeah.
who has just had major surgery.
Yeah.
You're like, I'm trying not to bump you here.
Even I actually got to walk it the other day with the construction people, and even the hallways, they don't have like the hard corner edges. They're like rounded, and they were talking about that. They mentioned about how it's so much easier to like transport patients around there. Because of that, because it's not making
I think
that sharp
that's
turn.
just the most thing I'm most excited about is more room.
Little things
more
like
room.
that to try to make it more efficient, more helpful for y'all, better for our patients.
Yes.
It's not just about having a nice new building. It is designed with the experience in mind.
It's designed with them in mind.
Absolutely.
I think that how our unit is set up currently, they're kind of like spread like that.
Like wings.
Having them kind of more like this, I feel like is a
little more compact.
Be a little bit more efficient for
We'll
us.
get to work together a little more closely.
Yeah, there's not 47 walls between us.
Yeah.
Yep.
So
It's gonna be good. I'm excited.
We're
I'm
excited.
excited for y'all. I know obviously
thank
it's
you.
gonna be a little learning curve as
It
we
will.
get
It will.
things
There will be growing
going.
pains
Yeah.
for sure, but those are not things we can't work through.
Yeah.
So we're excited.
I think we all have a little bit of anxiety about like getting lost in our new building.
Yeah.
Because it's like, you know,
We've been
we're
used to this.
so used to this,
Yeah.
and you know exactly where everything's at. You can pretty much walk it blindfolded.
Yeah, exactly.
But I'm kind
just-
of
We're excited.
I'm
And
excited
windows.
that y'all
I'm
will get
excited
to
about windows.
utilize this. I mean, it's very rare to get to go into a very new building like this,
Absolutely.
right? I mean, it happens, once every
My favorite
couple
thing
of decades.
Yeah, my favorite thing to tell my patients is right now is like, come back soon.
Yeah, go
Out
ahead. You
the
can have this
tower.
one and the next time.
Yeah.
Your next kid, we'll get you in the.
That's right.
Which I mean,
the
it is
suite.
hurricane season, so we'll be busy tonight.
Well,
That's funny.
And one last question. For anybody who's considering delivering their baby here at SGMC Health, what would you tell them about the care that they can experience?
you've got a lot of dedicated nurses, doctors, our surgical techs, our patient care techs. You got a lot of dedicated people here that are ready and willing and excited for you to just join in on this exciting time in your life. You know, it truly is such a blessing to be part of that, and we really, you know, love our jobs and we love taking care of these people. And I always say, if you're gonna have a job or anything in whatever you do, it doesn't matter if it's a job or a hobby or anything else, you gotta love it. Love it and put everything in that you've got. Give it your all, and we're all here and we're ready and we're willing, and we would love to welcome you into our family here to have a baby with us.
Yeah.
So
I mean, you nailed it with that. We have a lot of staff that do like outside training for their job.
Right.
Patient care techs that are car seat safety certified. I went and got a lactation certification just to be able to help with my
I've
patients.
got training in my fetal monitoring and obstetrical care. So
We're all kind of obsessed with our
certifications
job.
in that. Yeah,
so-
we are.
Being the best. I want to be the best.
We're a little
Well,
obsessed.
it's evident because you both have a lot of daisy pins on your badge, and that's when a patient or family member nominates our staff for going above and beyond. So that's evident in the care that you're giving.
We try so hard. Like when we read them, we're like, "Who was this?"
Yeah.
You know, because we love reading those, and we love to hear everything that everyone has to say about us. It means a lot to us, and we really appreciate our patients and their families, and we're just blessed to be a part of their journey.
Huge
Well,
blessing.
we're blessed to have y'all on the team at SGMC Health for sure.
Absolutely.
All right. Well, I think that wraps us up for today.
All right.
So
Well, thank y'all for having us.
Yes, thank you so much.